Hi, I'm Emma Wightman, Stockbridge Osteopath. I want to take the opportunity to tell you a little bit more about myself, and what it is that I do. I get lots of questions about the work that I do and my background, so I'm going to try and answer some of those questions. The top main questions, the top 5 that most people tend to ask is, what is osteopathy? What is it that we actually do? What do we treat? Who do we treat? What techniques do we use? How often do you need to come, and is it safe? So I'm going to go through those questions one by one and give you a little bit more information. So to start off with, I've been in practice for 20 years this year, and through that time I've worked in lots of different practices. I started my time in London, worked in a practice in Barnes, which I loved, and then moved down to the south. I'm currently practicing in Stockbridge, and in between that time I've worked in Hursley and Winchester, and I've also worked for myself from my own home, and gradually built up my own list of patients, which I moved to Stockbridge about 8 years ago. And now in Stockbridge, at the Stockbridge Osteopathic practice, we have a little team of practitioners. There's 8 of us, 4 osteopaths, a Pilates teacher, homeopath, naturopath, and a new addition to the team, a relationship counsellor. So we make a great little multidisciplinary team that I'm very proud of. We all worked very well together. My work is very general, so I work in all areas of osteopathy. My particular areas of interest are in pregnancy and with babies and children. So I'm also a qualified antenatal teacher, and have 3 children of my own, so really enjoy that aspect of my work. And a new string to my bow will be women's health, and I start a course on women's health in May, and really excited about it, and very much looking forward to learning a little bit more about women's health, really from puberty all the way through to childbearing, child rearing, and menopause, and of course getting a little bit more intimate with the pelvic floor. I love talking about bottoms, very happy talking about bottoms, so really looking forward to doing a little bit more and learning a little bit more in this area. So that's me. So on to the top questions. What is osteopathy? Osteopathy is a form of manual therapy, so we use our hands to treat. Some osteopaths will use acupuncture needles and other tools. I primarily use my hands. I don't use much other kit. And we see the body very much as a whole, and our focus is on the alignment and balance of the body. That's absolutely key with osteopathy, is alignment and balance, and when that alignment and that balance goes, that's when injuries can happen, that's when chronic pain can begin. So we look at the whole body from the foot all the way up to the head, and we dig a little bit deeper. So if the pain is in the neck, say on the right side of the neck, perhaps it's the lower back that's causing the issue, or a knee that's not quite strong enough, or even a dropped arch or a leg length difference, and those issues remote to the area of pain perhaps are the underlying cause. So our understanding of the body is quite different to that of conventional medicine. So when a person is in pain, or when they have an injury, or when they are ill or have a disease, we don't see it as a bad thing. It's not the body breaking down, it's not a failure in the body, it's not the body wearing out. It is the body telling us a story, and we need to gain a case history from our patients, and examine and feel and put their story, their history together in order to build this bigger picture, and really listen to the body in order to work out what it's telling us in its symptom picture. We don't try and suppress pain like conventional medicine does. We very much use that symptom picture as a way to guide our techniques and our treatment. So what do we treat? Well, anything really, because we don't just treat a painful joint or an inflamed ankle. We treat the whole body. So any areas of pain we would look at and be able to work on. Some of the most common conditions, to give you a little idea of our most sort of common patients, are spinal aches and pains, low back pain, neck pain, shoulder pain. Also peripheral joints, elbows, wrists, ankles, feet, knees. So lots of musculoskeletal conditions. But also we go a little off-piste. We will treat period pains, asthma, migraines, plantar fasciitis, calf cramps, tennis elbow, lots and lots of different conditions. And we also treat all ages, so from very, very young babies all the way up to elderly people. Ages, there's no exception to age for osteopaths. Patients quite often come in around 6 to 8 times. That tends to be our average course of treatment. Of course, it depends very much on the condition that you have and the background history, i.e. What all the other issues are that have been going on and leading to this point. So very dependent on the person. We plan individual treatment courses. We don't just say prescribe 6 treatments and that's your lot. We might say, yep, 6 treatments, and within that time you're going to be feeling an awful lot better, but you may need 1 or 2 more after that. Or maybe because we can't get you away from your desk or out of your car or whatever that lifestyle pattern that you have, it can't change. So maybe we look at maintenance programs and we say, right, let's see you once a month, once every 6 weeks, and just keep the body ticking over as much as we possibly can. So we're also, rather than just treatment based, we also advise on lifestyle changes, exercise, nutrition, diet, and we really put the whole picture together for you. We use a very variety of techniques, and it'll differ from person to person. I use quite a wide variety. I use lovely deep soft tissue massage, stretching, articulation, manipulation, the clicks and the pops that you might be familiar with. Also cranial osteopathy techniques, which are particularly suitable for babies and children, and a variety of other visceral techniques that can help with organ problems. Is it safe? Yes, osteopathy is very safe. 30,000 patients see osteopaths every day in this country, and we have one of the lowest insurance premiums of all manual therapists. So it's a very safe form of treatment. And if you have any worries about treatment plans or the techniques that we use, or whether the condition that you have is suitable to osteopathic treatment, you can ask us, and we'll have a very open, honest conversation with you about what we can do for you, and hopefully allay any concerns or worries. The Stockbridge osteopathic practice is a very well known and trusted practice within the area. We have a great relationship with our local GPs, and they regularly refer their patients to us, and also from the Andover Birth Centre. We get lots of referrals from our local midwives and health visitors, and love seeing all the pregnant mums and babies and all the patients that are referred to us from other local healthcare practitioners. So that's it, I think. And if you have any other questions about myself or the practice or osteopathy, please send me a message.